Hi guys, this is Caroline Peregrino, board certified psychiatric nurse practitioner out of California, and thank you for being in this video. I really would like to talk about money in regards to psychiatric nurse practitioners and how much we are being paid, at least here in California. So if this is your first time in my channel, this is about my struggles, my experience, my journey, the good, the bad, the ugly about being a psychiatric nurse practitioner, and I'm hoping to impart some of that knowledge and skills and learning that I was able to attain throughout that 5 years as a psychiatric nurse practitioner. So if that's something that you would like to get more information about, please do subscribe to this channel and hit the bell button so that you are notified every time there is a new video that comes out. Okay, so 3 things that's really important when you're thinking about how are nurse practitioners paid. You need to know 3 different facilities. This is in California. 3 facilities where a nurse practitioner can work at would be 1, a hospital organization, 2, others owned private practice, someone else who owns a private practice and you are either an employee or independent contractor. So it could be a doctor who owns it, or another nurse practitioner who owns it, or a therapist or psychologist. Number 3 is if it's your own private practice. So all of this would have different pay structure and different, reimbursement type models depending on what they do. So talking about hospital organizations usually go by what is the going rate within the area that they're at. So if you work for a big hospital organization, they match usually kind of pretty similar to what other NPs are being paid at the hospital at another facility. So that's pretty much set. And it's based on a step level, based on your experience, and it could also be benefited or not benefited. So usually it could be anywhere between $80 to $100 or more as a psychiatric nurse practitioner. Usually $100 per hour with benefits if you have at least 3 to 4 years experience or more. And less than that would be if you have less experience. Okay, so others own private practice. If you work at another facility, at another clinic, whose practice is owned by a doctor, for example, so you need to know whether 3 things: are you going to be paid salary? Are you going to be paid per hour? Or are you going to be paid per patient? And those are the 3 important things that you need to know, right? And you also need to know what is the clinic's pay structure or reimbursement structure. Are they billing the patient by insurance, using their insurances? Or is it only cash pay? Or is it incident to billing? So billing insurances could be patients who has Anthem, Cigna, you name it, all of those. And it depends on the contracted rate between the office or the clinic and the insurance. And there's also another part of that is the insurances billed incident to billing. And I know there's a lot of stuff here. Incident to billing, meaning it's based on the MD rate, even though you're the one seeing the patient. That just means that the MD is billing the insurance as if they're the one who saw the patient, but it was you. And it's legal, and it's called incident to billing. And that just means that the doctor has to be there in the clinic, present during the time that you see the patient. Not necessarily in the same room as when you're seeing the patient, but present within the clinic. So it's called incident to billing. And so the insurance is billed based on the doctor's rate, not on the NP rate. Usually the difference between the MD rate and the NP rate is paid 80% of what the MD rate is. So it's about just 20% difference. So if the reimbursement schedule for a 30-minute follow-up visit is $200, then NP is paid 100, I'm bad at math, so 80% of that, so 80% of that is, what the NP is going to be paid based on that reimbursement schedule. Now, because it's a private practice owned by that doctor, he needs to pay for expenses. He needs to have some profit, right? She needs to pay for the space, pay for your insurance. So there's expenses hiring you. Running the business, and of course they need to have a profit. So that is going to be something that you and the MD or the other nurse practitioner owns the practice need to talk about. So if the doctor is getting 100% of their rate, and it also depends on the insurance. Some insurance pay basically very small. Some insurance pay pretty good amount, and it could be anywhere between $200 to $250 or more, just depending on what the contracted rate is per 30-minute visit, and bigger for a 1-hour initial evaluation. So if you were to ask the one who owns the practice what you're going to be paid if it's an incident to billing, so you can get paid if they're getting, like, say, you probably want to know how much they're getting per follow-up visit, and you can do a percentage or a set amount, and it could be per patient or per hour. So let's say the practice is getting $200 per patient, right? If it's incident to billing for your 30-minute follow-up, then you can, probably bargain between 50 to 60% of that contracted rate to go to you. And I think that would be probably without benefits. It would just be per patient, 60% of what is the contracted rate goes to you. Now, if the practice is not doing incident to billing, they're actually having you contract with the insurances, then it would be a lot less than if it's incident to billing. And again, it could be two types. You can do percentage, or you can do per patient, and it could be anywhere from $75 to $100 per patient, or 30-minute follow-up. That's what I mean. So it could be larger for a initial evaluation because it's an hour, and it's usually a larger reimbursement schedule. So again, it depends on one insurance to another. One insurance like Cigna pays different than Anthem, and there's usually a big gap between them, and that's also another thing that we can talk about later, how to bargain that and contract with insurances. But it's different, so you need to know those things in terms of being able to talk to the owner of the practice and find out, okay, what are the billing, how much are you billing for a 30-minute visit with me, and how much are you going to pay me, and how much do you want to get paid? So it could be 60%, 70%, or 50%, depending on what the rate is. Or sometimes some practice would do it as a set amount, $75 per patient visit, and I usually, this is just me, would not go less than that if you're a new nurse practitioner. But if you're not a new nurse practitioner, $75, I think, for a 30-minute follow-up visit would be very low for someone who's quite experienced. Okay. Now, if it is your own private practice, then you're gonna have to think, is this a cash business or is this gonna be an insurance business? Cash business usually does not drive that many patients, just because, not unless you're in an area where it's possible, but in an area where it's average kind of I guess cost, or then you can get I think it's best that you do insurance so that you can have more patients, and if you do, insurance rates aren't that bad. It could go anywhere from depending on the codes that you're going to be using, depends on the severity of the patient. It could go from anywhere between, $80 per 30 minutes to $200 per 30-minute visit. So that insurance reimbursement all goes to you because you own the practice and you pay for the expenses. So it could be anywhere from, again, like what I said, 30-minute follow-up from $80 to $200 if also you do therapy on top of medication management. There's a lot more to talk about in regards to that, but that has been my experience. So new nurse practitioner in a hospital can get paid between $80 to $100 or more per hour. As a psychiatric nurse practitioner with benefits. If it's a other people owned private practice, it depends on their billing, how they bill the patients. Could be cash pay, could be incident to billing, or it could be insurance reimbursement based if you're contracted with insurance. And it could be anywhere from 50 to 70% of what's the insurance billing rate, because the practice also has to earn some money from you because of the expenses, right, that they have to incur plus profit. Number 3 is if it's your own practice, then all the insurance reimbursement, all the cash payment goes directly to you, but you have to pay taxes because it's a business tax, right, on top of the expenses, the room you're renting, the office you're renting, a lot of other things. So that's where we are. You can get paid as little or as much depending on, again, insurance reimbursement and the bill pay structure of the place you're working at. Okay, hopefully that makes sense. And if you have specific questions, please just write it in the comment and I will be glad to answer it. And if you like this video, please do click the like button and subscribe so that I can continue to help more nurse practitioners learn more about the practice and being a nurse practitioner. Okay, thank you so much. Bye.